with us this morning, we have Dr. Michael,
Morning.
our Makati doctor. Thanks for being here today.
Thanks for having me.
We're going to talk about chiropractic,
Yeah.
of course, and how chiropractic has impacted your life and the people here in the Philippines. So let's start off by talking about, a little bit about yourself and how you got here in the Philippines.
Sure. So I actually got here 6 years ago now.
Nice.
And how I got here it wasn't a direct route, I would say. I'd worked at home for about 5 years. I graduated.
Where's home?
From Toronto,
Okay,
Canada. And so graduated 2015
From chiropractic school.
from chiropractic school.
Okay.
So 4 years of chiro, 4 years before that of
Right.
undergrad, right?
Right.
So a lot of
8 years of
schooling.
school.
Yeah.
It's a lot.
Right. Definitely worth it though.
Yes.
Right, absolutely. And then got into the field, started practicing
In Canada.
Okay. And learned quite a bit. But previous to Cairo school, I'd spent a year out in Asia. I was an English teacher in Korea.
Wow.
And I traveled around a little bit in South Asia, and so it was always kind of, in the back of my mind, I wanted to go back and explore a little bit. After a few years of practice, kind of decided, I want to see what my options are. Maybe I want to go abroad again,
Okay.
right? And so I started looking around. In Asia, options are a little bit limited because English is a big issue, right? And so there's kind of two options. You have Singapore, you have the Philippines.
Right.
And Singapore is very expensive,
Right.
kind of small.
Right.
And so I figured, I found an opportunity here in the Philippines. So I said, why not? Let's go.
Wow. So that's a big jump from Canada to Philippines. Hadn't been here before.
Never been here
And
before.
Just came here and moved.
Never been here before.
That's a good story.
Although at the time I was seeing a Filipina
Okay.
back in Canada, so she kind of told me a little bit about it. And so I decided to take the leap. I didn't start working for Doc Rob's
Right.
at first.
You were
right?
working for another
I was working for another
chiropractor here in the
chiropractor.
Philippines.
Yep. I was here for about a year, and then the pandemic hit.
Right. Okay. 2020.
And so things changed quite a bit. And
So
then
how did you learn about me?
actually, a former colleague of mine had worked for you previously.
Okay.
And so I was kind of looking to change things up a little bit.
Okay.
And he told me about you guys.
Okay.
And so I thought, okay, I'll give it a shot. And I wanted to have a chat with you. I remember sitting down, having our chat. I had that long pandemic beard going on. I'm surprised you called me back after that, actually. But yeah, I heard really good things, and that you guys are really, you have the right philosophy,
Okay, I got you, yeah.
really patient forward, long-term care, more
Okay, let's talk about that philosophy
Yeah.
because a lot of people don't really know what that means. What does that mean when you say philosophy?
So there's different ways of practicing
Right.
in chiropractic, and it can be just kind of like medical based. So for example, you have pain, you come in, you do
Right.
an adjustment to cure the pain, and then that's it. So
Right.
almost like a bandage, right? Like taking Tylenol, taking aspirin, something like that if you have pain,
Right.
whereas here it's more of addressing the underlying issue, and a lot of times that could be posture related.
Right.
And then also just correcting for long term, right? So for your lifestyle, because they're always putting our bodies under stress,
Right.
whether it be physical, chemical, emotional.
So you, sorry to interrupt you, but you believe that we should be adjusted forever.
Yeah, definitely. Because it's just like you should always exercise.
Right.
You should always try to eat well.
Right.
Always try to get good sleep, right? And you should try to keep your
Healthy
spine
lifestyle.
healthy. Yeah, healthy lifestyle.
Right. Right. If you have back pain, it's hard to do those things.
Yeah.
It's hard to exercise.
Yeah.
It's hard to eat right.
Yeah.
Right. So chiropractic so a lot of people don't know chiropractors. When we start practicing, we have a choice to make. What kind of style of clinic do we want? Do we want to be a sports and take care of athletes and get rid of back pain? Do we want to take care of babies and families?
Yeah.
And that's what I developed years ago was that strong philosophy that we believe chiropractic is great for everyone, forever. And so I adjust my children, even though they don't have symptoms, they don't have back pains, because I believe in chiropractic. So ultimately that resonated with you, was that philosophy, right?
Yeah, absolutely. And I mean those kind of long-term intangibles, I think, are really is what I get the most enjoyment out of when I'm practicing. Things like when patients say, Doc, I've only ever been able to sleep like 2 hours a night or 3 hours a night. And since I've been seeing you for, you know, X number of time, now, you know, I sleep full night.
Right.
And that's pretty amazing. And that has nothing to do with back pain.
Right. And that's you'll see things start to change that they didn't even come in for.
Yeah.
And that's very exciting. So a lot of doctors, a lot of chiropractors just kind of focus on getting you out of pain.
Yes.
Right. So, and what people don't understand is, you know, that why this happens, but why is it that the back pain, why does it always come back?
Yeah.
Right.
Yeah.
And that's just because, like you said a while ago, is that we always have these stressors, like what we do for work, how we sit, how we sleep, exercise,
Yeah.
you know, playing with our children. So that's why, you know, our symptoms always come back. So we here at Doc Robin Associates believe in regular care so that your symptoms don't come back.
Yeah.
And then you have all these other amazing benefits that take place. Your sleep
Yep.
is improved, which means your body's recovering, which means your immune system's stronger, which means you get sick less often. So there's all these residual cascading benefits that take place, which I love.
And it's very much like it's that going through that first doorway opens up so many other things in
Right.
your life, right? So if you're not sleeping well, if you do have back pain, right? And that's usually what brings people in
Right.
in the first place, right? But if you're in pain, then you're not likely to eat well because you feel bad about yourself, right? You're not exercising because it hurts, right? And so all these things kind of build on one another, and your health gets worse and worse.
Right.
And when we're kind of that first, okay, you know, I'm gonna take that leap.
Yeah.
Now I start feeling better. Now I want to eat better. Now I want to be healthier. I want to exercise more, and it's really like a lifestyle changing
Right.
thing.
And that's, you know, our clinic, when people come in, of course, that's what we're talking about. So they're a little bit shocked, like, oh, you're not just talking about my back pain, you're talking about really changing my health.
Yeah.
And that's the message that we're trying to get across, right?
Yeah.
So, you know, I just wanted to, you know, go over, you know, the things that I look for when I'm hiring someone, because it's a big deal. We don't just hire anybody, you know, throughout our time here of having multiple clinics. You know, we've interviewed many, many doctors and turned away several, because there's several factors that we take into account when we bring someone here at one of our branches. Obviously, you have to go to chiropractic school.
Of course.
That's the first thing. Second, you need to believe in our philosophy, or at least be willing to adapt.
Yeah.
You know, because some doctors actually come from a pain kind of program, a pain style program, but they're willing to adapt to this more philosophical long-term approach. And then the third thing is you have to be an excellent adjuster.
Yeah.
Right, so a chiropractor needs to be able to adjust the spine. If you can't adjust, then your results are going to not be so great. You're not going to get referrals. Your clinic is not going to be very successful.
Yeah.
And so those are things that I looked when I brought you in. You know, you're a great guy. You're willing to adjust to our philosophy, and you have this passion and this drive to ultimately help Filipinos, and that's why we came here to continue to spread this message and help more Filipinos. And you're an excellent adjuster.
Thanks,
You're my
man.
go-to.
Thank you.
I still get adjusted at least 2 times a month. I've
Yeah.
been under care now for 30 years.
Yeah.
I started when I was 20. I'm now 50, and so I still get adjusted by you quite often because you're an excellent adjuster.
Thank you.
So can you touch upon about your belief in your adjustment skills? Where does that come from?
Yeah, so believe it or not, actually, before I came to the Philippines, I wouldn't say I was the most confident adjuster.
Right.
And I kind of came from that background where it was more of a pain-based
Right.
experience and type of treatment protocol that I was doing. When I came here, it's quite different, and I definitely embrace that type of philosophy, and it works a lot better with the way that I think about health.
Yeah.
And in that sense, you're adjusting a lot more people, and there's a lot of people that help to kind of mentor me along the way.
Mm-hmm.
And then it's just learning slowly over time, trying to get better at learning what you feel when you're touching patients, when you're palpating them, learning to listen to patients as well. And it's that kinesthetic sense that you develop over adjusting more and more patients, right? Experience. That's really what it comes down
to.
to.
And now you're 10 years over 10 years?
Yeah, over 10 years. Yeah.
It really does come down to experience. The more people you are palpating and adjusting, you learn so much.
Yeah.
And when you're young and fresh out of school, your adjusting isn't as confident, and your belief in yourself. And and I really believe that our belief in what we do, it does play a role in a person's results. The more you believe, there's something about that energy that is
Yeah.
transferred to the person. There's really something to that, and that's one of the powerful things about chiropractic. We're touching with our hands. That healing touch, it really is a big deal.
Most people don't get touched, actually.
Right.
You know, and so even if it's just, you know, it's just having somebody else put their hands on you and in a caring way and helping you to improve your life is really a powerful thing, right? And I think people kind of, especially in today's day and age, and maybe not so much in the Philippines, right? People here are very family oriented.
Yeah. Sure.
But definitely back home, back in the West, yeah, a lot of people are not, you know, don't get that.
Mm-hmm.
And so it goes a long way.
Right. So, do you have some amazing success stories or miracle patients you
Oh
can
yeah,
share with us?
definitely.
Right.
But before we get into that,
Okay.
I do just, you know, I had something recent happen, and I just wanted to mention, because we're kind of talking about chiropractic and, you know, not just the adjusting, but there's lots of factors that are involved. And one thing that's really important is the fact that we're doctors,
Mm-hmm.
right? So we're trained to be diagnosticians,
Right.
and that's very important, where a lot of others are not.
Right.
And so just recently I had an experience where I had a patient come in, older gentleman, had some back pain, things just didn't seem right. You know, I did some tests, you know, it didn't seem right to me. Got some positives here and there, so
Right.
I sent them out, and unfortunately the gentleman had bone cancer.
So you referred him to another doctor.
I referred him to another doctor, but if he never came in here, and if he just went to like a physiotherapist or to somebody who wasn't going to like properly diagnose, you know, we never would have caught it. And hopefully we caught it early enough,
Yeah.
so we can save it.
You bring up a really great point, and I'm very proud of our schooling.
Yeah.
Chiropractic school is 4 years after college, and it's just we get such good education on diagnosis, differential diagnosis, and that's what people don't oftentimes appreciate. We need to be able to identify everything. We learn about every single system in depth and how it operates. So when people come in with certain red flags, we need to be able to identify.
Yeah.
So I too agree with that. That's what really makes us doctors.
Yeah.
I'm very proud of that. Because there's just a plethora of things that people can have, whether it's ankylosing spondylitis or they just had a stroke, or they've got obviously heart issues or cancers.
Yeah.
And so that's why it's real important to go to a real chiropractor so you can get that proper diagnosis.
Definitely.
Yeah, I absolutely agree with that. Because throughout our time as chiropractors, we come across a variety of different issues.
Everything, right? People come in for pain, and usually, right?
Yeah.
And
Well,
anything can cause it.
What I find interesting here in the Philippines is people actually I get some amazing cases. I've had people come that were paralyzed from the neck down.
Yeah.
They come in an ambulance.
Yeah.
In America, that doesn't happen
No.
anymore. They go pretty much to the chiropractor for back pain.
Right.
But I'll have a 2-year-old with cerebral palsy that can't even move their body.
Yeah.
So we are taking care of things that in the early days in chiropractic, that's the stuff that they were doing.
Right.
In the early 1900s, D.D. Palmer and his son B.J. Palmer, they were taking care of people from the Mayo Clinic that were, rejects. They couldn't do anything. And so they would give them to these chiropractors and hope they could help. And that's amazing. I'm getting chills right now just talking about it, because that is so gratifying, and we can help people. This 2-year-old with cerebral palsy, the mom continues to bring her because she has better sleep.
Yeah.
She's getting stronger. So these things, there's something to that, and it really works. So
Yeah.
we have so many great stories, I'm sure.
Yeah, and like little changes in someone's life goes a long way, right? And you can't discount that. Stories in terms of success stories. Many. One of the most common ones that I've had, and actually happened even with staff members, is trying to get pregnant.
Right. Yeah. I was going to say that too.
Right? I'm sure
how
you've
many
experienced that.
babies, you've been doing this 10 years, how many have you said that you've gotten? Now, it's funny how we say this. When people come here, oftentimes they come here to get pregnant. They have fertility issues.
Right.
And they've heard how chiropractic can help.
Yeah.
And can you explain that? How does chiropractic help someone get pregnant?
So a lot of times there's issues with nerve function. Right? And the nerves in your spine, they go to your reproductive system.
Right.
And so if those nerves can't function properly, if there's blockages in those nerves, then those systems in your body aren't going to function properly. The other thing too, sometimes, when you are getting pregnant as well, if the hips can't move properly, then the baby can't.
So it's great for the birthing process.
Great for the birthing process
Yes.
too, right? I'm
Speeds
jumping
up
ahead a
birth.
little bit, but yeah.
You're right.
Yeah. Yeah, I would say since I started working with you specifically, so it's at like 2-3 years, probably 3 or 4.
Wow, already.
Yeah,
That's amazing.
maybe.
Yeah.
At least, I mean, yeah, one of the staff
Yeah.
for sure.
Uh-huh.
And then, 2 or 3 others.
Yeah.
Definitely.
So how, and just to elaborate on what you said, there's blockages. And so I always tell people when they come in that initial consultation, chiropractic, we don't cure anything.
Yeah.
We don't cure back pain. We just allow the body to heal itself.
Right.
And so if we have a nerve interference due to a spinal misalignment in your lumbar spine affecting the function to the reproductive organs, that's how we help with that.
Yeah.
We influence nerve function. We don't cure anything. We just allow the body to function properly.
Yeah.
And that oftentimes helps someone get pregnant. So I have a patient still come with her baby. She brings her in, and it's now like 2 years old. Like, this is the baby that you helped make. So it's so funny. People think, oh, you help people get pregnant, but it's through chiropractic. So
Yeah.
it's really amazing.
Yeah, it is. Yeah.
So what else?
What else? I've had a patient. So I had a patient. Again, maybe 40, 50, so not that old. Really, really overweight. Really overweight. To the point where he was in a wheelchair, couldn't walk. Was able to, walk with a cane from the chair to the table, but that's kind of the extent. Went through some bad depression, and kind of things just spiraled.
Right.
Wasn't sure if I could help him. Really, when I looked at him, I was like, oh, I don't know. Like, well, and I was honest. I said, no, we'll give it a try.
Yeah, sometimes you don't know.
We'll see, right?
Yeah.
One adjustment. Didn't see him for 2-3 weeks. He said he was gonna come back, but I was okay. Didn't see him for a few weeks, and came back and was like, Doc, it's unbelievable. Like, I was able to walk better. I could sleep better. I was able to walk for longer periods without using my wheelchair. I feel fantastic. He said, I want to come in now, like, going forward, even just the smallest thing makes a huge difference. I was blown away because I really didn't think that I'd be able to, even especially after one adjustment, to be able to help this person. But definitely.
And these stories, they're every single day. That's what we experience miracles every day, every day. And I think sometimes people, it looks so easy. Because what we do, it doesn't take a long time, and you'll see now people kind of copying chiropractic, especially here in the Philippines. There's a lot of phony chiropractic,
Sure.
and they're just twisting, and I'll get comments sometimes, oh, you're just twisting the back and doing the same thing. That's not true. Chiropractors, we locate the exact joint that's misaligned, or which we call subluxated, that's actually impairing that nerve. So we really are dealing with the nerves, correct? And not just cracking one's back. And that's what a lot of these people that aren't real chiropractors are doing. They're just cracking the back. We are locating the joint that's stuck, impairing nerve. So our goal is to be very specific. And sometimes with our videos and marketing, it looks so easy. But my point with this is we experience these miracles every day. Yeah. Recently I had, and this happens often, we had a person that really needed back surgery. So they thought they had a disc injury, a disc herniation, pain down their leg. We're really contemplating surgery. After just 2 or 3 sessions, she's like probably 50% better. What other thing like that exists where you can come in and have these sessions that take 5 to 10 minutes and get such significant improvement?
Yeah, and I want to touch on that for a second too, is that a lot of times people think that if you have back pain, and if either severe back pain or long-term back pain, that really your course of action is surgery, right? And a lot of times they don't know any different option, right? And so if that's the only thing that you're told, then okay, that's what I need to do. You can't go back after surgery, right? If it's not successful, then like that's it, right? And so chiropractic is, like you said, so many successful stories, and so many people. Same, I've had so many experiences where I've been told I need surgery for my back, and sometimes they just have some spondylosis, which like just some arthritis, essentially, right? And it's like, man, you don't need surgery. No one should be touching your back in that way, right? All you need is some motion in there, and you need those joints to get healthy.
That's right, and that's why we came here, to like tell Filipinos, hey, there's this other thing that you can do that is going to really change your life, and you possibly aren't going to need surgery, and, and ultimately going to prevent problems. And that's why we love being chiropractors, right? We help people naturally, be healthy. And I think we sometimes as chiropractors forget just the amazing things that we do on a daily basis. We help so many people, and that's one thing I love about being a chiropractor.
Yeah, that's really the message that I try to get across the most, is that we're trying to, with what we do, we're trying to improve your lifestyle going forward, right? And being able to do that just with, a visit once or twice a week that doesn't take very long, but makes a huge impact on your life. I mean, it's a little time commitment, but like a huge long-term benefit.
And one of the reasons I loved bringing you on board our team is because you walk the walk. You walk the talk. You're a healthy person.
Yeah, oh yeah.
And
I try to be.
Myself, like say for example, you're going to invest money with a trader, a stockbroker. You want to invest with someone that makes money, right?
Sure, yeah.
Well, when you're talking health, do you think it's important that we are aligning ourselves with a healthy person?
Yeah.
Right?
Oh yeah.
So you're obviously a healthy person. You eat right.
Yeah.
You exercise. You get adjusted.
Very important.
Sleep, you have a positive attitude.
Yeah.
These are the things that are vital, and so that's why I was very excited to bring you on board with our team. So let me ask you this, Doc. What are some things that you love about the Philippines?
Oh, yeah. So I mean, well, if I didn't like it, I wouldn't still be here, right? But
The longer you're here, the more you love it.
Yeah, for sure. Well, actually, you know what? I'm married to a Filipina, so I just got recently married.
Congrats.
Yeah, thank you. And so I've been we've been together now 4.5, almost 5 years, and so I mean she's wonderful. Her family's wonderful. Her family's from Laguna, so we go out there, and her parents always prepare like wonderful food for me.
What's your favorite Filipino dish?
My favorite, I really like sinigang. I like bulalo as well.
Wow.
Yeah, it's not super healthy, right? but it's delicious.
Every now and then, it's okay.
It's delicious. Yeah. There's always a feast. And it's lovely. And hanging out with, just like Filipino people are so nice, and they want to sit and chat forever and find out about you and vice versa. It's really nice.
You know what I love about Filipinos? It's like everyone is a family.
Everyone
is connected.
Yeah.
Here in like our waiting room, if there's multiple patients that don't even know each other, they still can have a conversation and talk. And those are things that we don't get back home.
You know what amazes me is that sometimes I'll see like the Grab delivery drivers or the Angkas drivers. They just sit and talk at the lights. Yeah. Like, what are you talking about?
You would never see that back home.
Never in a million years.
Stay in their lane.
Yeah.
Here, though, I love that about Filipinos.
Yeah.
They're very happy.
Happy, open, friendly.
Yeah.
And it's definitely a very welcoming environment. Yeah. And so a huge part of why I stay.
I agree. It's a feeling that we get, outside, but also inside. The love that we have with our patients. Yeah. Right? I mean, that's not matched. We cannot find that back home. It's really, and our clinic's goal was to really create this family environment. Our clinic is really set up like a house. We want it to be very welcoming.
Yep.
And I think all of our doctors, our message is the same. It's about helping you get healthy. And of course, alleviate your back problems, but our goal is to change your health. And we obviously do that through the adjustments with education, our stretching program. So I'm so proud of what we have going here and continuing to help Filipinos, which is why we're here, right?
For sure. And it's not just the doctors, but, the girls that help us, fantastic. Yeah. Right? And they're always, they're friends with all the patients, right?
Course, yeah.
Yeah.
Those are the biggest reasons we love being here. I think we can agree on that.
Yeah.
Well, thank you so much, Doc. It's been a pleasure to talk with you today, get to know you more.
Yeah.
And let's get adjusted. Can I get adjusted?
Yeah. Thanks, Doc.
Thank you.
All right.
Hey guys, here we are in the Makati branch, and today we're going to get adjusted by Dr. Michael, my Makati doc. Let's go.
Okay, ready, Dr. Rob?
Let's do it.
All right. Take a deep breath. Good.
All good.